Cancer is the leading cause of cancer-related deaths worldwide. It causes more deaths annually than colon, prostate, lymph node, and breast cancer combined. Fortunately, most lung cancer cases can be prevented. Smoking is responsible for nearly 90% of all lung cancer cases. The risk of lung cancer increases with the number of cigarettes smoked and the duration of smoking. Even if you have smoked for many years, quitting smoking can significantly reduce your risk of lung cancer. In addition to smoking, exposure to asbestos, radon gas, and secondhand smoke can also cause lung cancer. By avoiding these factors, you can further reduce your risk of developing lung cancer. Take control of your health and make choices that protect your lungs. Quit smoking and minimize exposure to harmful substances to lower your risk of lung cancer. Small cell lung cancer, also known as a malignant tumor, is shaped like an oat spike and is more common in heavy smokers. Non-small cell lung cancer is a general term for several types of lung cancers, including squamous cell carcinoma, adenocarcinoma, and large cell carcinoma. Stage 1A, cancer has penetrated the lung tissues up to 3 cm without spreading to nearby lymph nodes. Stage 1B, cancer has penetrated the lung tissues with a diameter of 3 to 5 cm without spreading to nearby lymph nodes. Stage IIA, cancerous tumor has grown between 5 to 7 cm and entered nearby lymph nodes on the same side as the tumor, but not the chest wall. Stage IIB, cancerous tumor has grown between 5 to 7 cm and entered nearby lymph nodes, but not the chest wall. Also includes lung tumor larger than 7 cm. Stage IIA, cancer has spread outside the lungs and moved to lymph nodes in the center of the chest. Stage IIIB, cancer has spread locally to the heart, blood vessels, trachea, esophagus, and lymph nodes in the collarbone area or surrounding lung tissues or chest. Stage 4, cancer has spread to other organs in the body, such as the liver, bones, or brain. Small cell lung cancer, limited, cancer is present in one lung and nearby lymph nodes. Small cell lung cancer, expander, cancer has spread beyond one lung and nearby lymph nodes, possibly affecting both lungs, distant lymph nodes, and other organs. Stages of lung cancer, symptoms may not appear. However, as the disease progresses, common symptoms include a persistent cough that doesn't go away, changes in a chronic cough or smoker's cough, coughing up bloody sputum, shortness of breath, chest pain, hoarseness of voice, Pankos syndrome characterized by shoulder pain due to tumor pressure on nerves, and superior vena cava syndrome with symptoms like head fullness, shortness of breath, chest vein protrusion, and facial swelling. If you experience a persistent cough or notice changes in your chronic cough, it's important to consult a healthcare professional. Coughing up bloody sputum, shortness of breath, and chest pain are also signs that should not be ignored. Hoarseness of voice, shoulder pain, and symptoms like head fullness, shortness of breath, chest vein protrusion, and facial swelling may indicate advanced lung cancer. Early detection and treatment are crucial for better outcomes. Remember, lung cancer symptoms may vary from person to person. It's essential to be aware of any changes in your health and seek medical advice if you have concerns. Stay informed, prioritize your well-being, and take proactive steps towards a healthier life. Together, we can fight against lung cancer and improve outcomes for everyone. Cancer can develop in the cells that line the lungs. Smoking is the main cause, both for smokers and those exposed to secondhand smoke. However, lung cancer can also affect non-smokers. In these cases, the reasons for its development may not be obvious. Certain factors increase the risk of lung cancer. These include undergoing radiotherapy treatment or having pulmonary fibrosis. Pulmonary diseases and minor infections can also contribute to the risk of developing lung cancer. Exposure to environmental toxins like asbestos, radon gas, and other metals can increase the risk of lung cancer. People infected with AIDS may have a higher risk of developing lung cancer. Genetic factors can play a role as well. Individuals with close relatives who have had first-degree lung cancer are more likely to develop it. Passive smoking, inhaling secondhand smoke, can also increase the risk of lung cancer. Inhaling smoke from cooking and heating ovens, Inhaling smoke from cooking and heating ovens, especially from wood and coal ignition, can contribute to the risk of lung cancer. Smoking injures the cells in the lungs, leading to lung cancer. Cigarette smoke contains carcinogens that cause immediate changes in lung tissues. Initially, the body can repair the damages caused by smoking. However, repeated exposure to smoke continuously damages healthy lung cells. Over time, these damages cause abnormal cell behavior and the formation of cancerous tumors. Lung cancer can spread to other organs through blood and lymphatic vessels. Symptoms of lung cancer may not appear until it has already spread to other organs. There are controllable risk factors, such as quitting smoking, that can reduce the risk of lung cancer. However, there are also uncontrollable factors, like sexual affiliation, that can increase the risk. Can lead to various complications, including fluid accumulation in the chest, spread of cancer to other organs, and even death. When it comes to diagnosing lung cancer, doctors are still uncertain about the necessity of scanning examinations such as X-rays or computed tomography. However, recent recommendations suggest that individuals who smoke more than 30 cigarettes a day for 15 years or more and are between the ages of 55 and 77 should consider X-ray and computed tomography examinations. If someone suspects they have lung cancer, it is important to consult a doctor who can perform tests to detect cancer cells. These tests may include imaging tests, saliva examination, and tissue examination. After confirming the diagnosis of lung cancer, the doctor determines the stage of cancer in the patient. Determining the stage of cancer helps the doctor make decisions regarding the most appropriate and effective treatment methods. Examinations to determine the stage of cancer may involve procedures like magnetic resonance imaging, positron emission tomography, and bone scan. It is important to discuss with the attending physician to determine the appropriate and effective medical procedures, as some examinations may not be an option for lung cancer based on various factors. Surgery is a common treatment for non-small cell lung cancer types 1 or 2. Different surgical procedures may be performed, such as removing the cancerous tissue along with surrounding healthy tissue. In some cases, an entire lobe of the lung may need to be removed through a procedure called lobectomy. For more advanced cases, a pneumonectomy may be necessary to completely remove the lung. Videothoracic endoscopy is a minimally invasive operation used for early-stage non-small cell lung cancer. During surgery, the surgeon may also remove lymph nodes in the chest area to check for the presence of cancer cells. If cancer cells are found in the lymph nodes, it indicates that the cancer has spread beyond the chest. Video, we will discuss drug therapy options for lung cancer. 3 focused drug therapy options for lung cancer are gefitinib, erlotinib, and afatinib. While there is no guaranteed way to prevent lung cancer, you can reduce the risk by following these measures. First, avoid smoking altogether. If you are a smoker, it's important to quit smoking as soon as possible. Additionally, avoid passive smoking and exposure to carcinogens at work. Conduct tests to detect the presence of radon gas in your surroundings. Maintain a healthy diet rich in vegetables and fruits. Limit alcohol consumption or avoid it altogether. Alternative treatments for lung cancer may be tempting, but they are not supported by medical studies.